for everybody. And I see it regularly in healthcare. Most of my patient population is 60 and above, and not only in the patients I treat, but when I walk around the hospital, falls are a big deal. My orthopedic surgeon colleagues, the big thing that keeps them busy when they're on call is not really sports injuries or car accidents. It's really falls. I would say 60 or 70% of the admissions that my orthopedic surgeon colleagues get on any weekend is a fall injury, where someone has fallen and broken their hip or broken their femur. And these are typically in 70 and 80-year-old people, really, actually, quite honestly, mostly females, but still some men. And so falls are a big deal. We have all sorts of stuff about fall prevention in the hospital. If any of you have ever been in the hospital, the nurses are always coming and putting your rails up, and they're lowering your bed so that they don't want you, number one, if you fall out, it's a less distance of a fall, but also they put your rails up regularly. That's part of their training because they don't want you to roll and fall out of bed. You go, well, why is that a big deal? But I don't fall out of bed at home. But there's certain characteristics and things that lead to more falls, and I'll kind of talk about that. And then I want to talk about what you can do to address the issues of falling and how to make it less likely or do some fall prevention stuff. Okay, so I think there's a number of factors that lead to increasing fall risk and then issues related to falling. The things related to fall risk are, as we age, our balance gets worse, our strength gets worse. Dementia, as we get old, has some element of increased fall risk. Despite the fact that dementia is mostly a cognitive deficit, there is some associated increased risk of falling with dementia as well. Also, in our population, as we get older, we're on more medications, and the reality is the more medications you're on, that there's side effects from those medications, and there's interactions between the medications that increase your dizziness, vertigo, and risks of falls. It's not unusual for patients to come in and tell me they started a new medication and they get dizzy all the time. But they still take the medication because they need it for their blood pressure or they need it for something else, for their heart, and so then they're at increased risk for falling. As we get older, people are unsteady. You see they don't walk as easily. Diabetics, because they lose the feeling in their feet, they often walk funny, and therefore they are at increased risk. You'll see a lot of older people who walk kind of a little bit funny with their hand along the wall because they need that extra balance. Now, this actually hits close to home because we were caring for Maya's mom recently, who, as she's gotten older, I've noticed over the last decade or so that her balance, her steadiness, her gait, they've all changed. And to where now she walks real slow because she needs that steadiness, and then she'll grab onto stuff. And she's, quite frankly, one of the things is she's afraid of falling. And so we actually, some of the things I'm going to talk about today are some of the things that we were working on teaching her on how to feel better and do better and decrease her risk of falling. And again, the big reason to decrease your risk of falling is because of the hip fractures, because of the femur fractures, but also falling and hitting your head. I've seen that on a regular basis too. I've also seen elderly people who live alone and they fall and they can't get up. And that is when an elderly person falls and can't get up and lays on the floor for 10 or 12 hours, there's a syndrome that kicks in, and it's called rhabdomyolysis. And it's because they're sitting in one position for so long and they can't move themselves, they don't have that strength, muscle tissue begins to die. When that muscle tissue dies, it releases toxins into the bloodstream, and they get kidney failure and multi-system organ failure. And I have seen a person fall, be on the ground for 12 hours, and die because of it. Okay, so they didn't break anything, but they quite simply couldn't get up and there was no one available to help them up. So there's a lot of reasons to try to prevent falling. Okay, it's a pretty big deal. We've got a handout here that I think Maya's going to include a PDF in our WhatsApp group so that you guys can all download. We have several resources that she has printed up here for us. There's 6 things here, 6 steps to prevent a fall. Number one is find a good balance and exercise program. But I'm going to talk about that last, and I'm going to go in reverse order. So number one, talk to your family and friends, because they're a resource. They're people who know you and love you, and they can help work with you, just in the same way that Maya and I and the rest of Maya's sisters are now working with her mom to help address her issues and make it less likely that she falls. Number five, keep your home safe. So it does, just like when you have a new baby at home and you baby-proof a home, well, similarly, as you have an elderly person in the house who has an increased risk of falling, you might want to do things to make the house safer for that person. So remove obstacles, remove wires that might be on the ground or something that they could trip over. If there's a ledge or something, maybe create a little ramp so that they're not going to trip over that. Put grab bars in. I know that we're doing a grab bar for Maya's mom in the shower to give her some steadiness, because showers are classically slippery places. I've slipped and fallen in the shower before. It can be disastrous even for me, so think about that. So, and we also, for example, got a shower chair for Maya's mom so that she could be sitting and steady with showering. Another thing is you can get one of those shower handles so that they can sit and shower. So you can do things in the house to kind of fall-proof the home. So again, going backwards, vision and hearing checks. Believe it or not, so bad vision and bad hearing can lead to falls. So addressing those issues with the optometrist and the doctor or the hearing specialist can help improve the situation. Now, I mentioned medications. So number three on the list is review your medications with your pharmacist or doctor. Unfortunately, I'm a little bit skeptical about both, just because I don't know that any of those people, doctors and pharmacists these days, don't really sit down with you and review your medications and talk about interactions and talk about the side effects. If you're on 7 medications, a lot of times they're just prescribing them, and before long, you're on 7 medications, but no one's ever sat and talked to you about that. And so you or for the person you're caregiving, you have to be proactive. You have to go to that pharmacist or you have to go to that doctor and say, hey, let's, mom or dad or me, I've been feeling dizzy, I've been feeling unsteady. I'd like to look at my medications and address whether this is causing me to have some unsteadiness, some dizziness, and can we look at these medications themselves or their interactions. So you do have to be proactive, because I don't think they're going to reach out and help on their own. Okay. Number two, talk to your healthcare provider. And this is specifically not about healthcare, not about medications, but more about the healthcare provider can do a fall assessment, especially people who specialize in geriatrics and treating older people. They have assessments to do to test your steadiness, your gait, your balance, and do a fall assessment, and then maybe advise you on what you can do. And lastly, this is something that anybody can do, but what we did for Maya's mom is, and I already know all these exercises, but I went up and I went onto YouTube, quite honestly, and I looked up exercises for balance and strength. As we get older, over the age of 50, we lose 1% of our muscle mass per year. And so by the time you're 60 and 70, you're much weaker than you used to be. So we really should be doing resistance exercise. Now, I'm not talking about Arnold Schwarzenegger bodybuilding, okay? I'm talking about just regular resistance exercise to strengthen your muscles. That might be a 1 pound, 2 pound, 3 pound, 5 pound dumbbell, doing a few things. So resistance exercise is really important for all of us as we age in order to prevent the loss of that muscle mass and keep strength. And strength leads to balance. I created a video of 10 exercises for Maya's mom that help with strength and coordination. And I won't go over all of them, but just as examples, something as simple as putting a chair down with arms and sitting in the chair and standing up, sitting in the chair and standing up. Those are just called chair squats, okay? And what that's doing is help strengthen these leg muscles, because as people get older, they actually sometimes can't get out of the chair without using their arms to help them or pushing up, okay? And that, believe it or not, that leg strength is really important in balance, okay? Another thing that happens as we get older is our proprioception, or our spatial awareness becomes less. So there's a little exercise where you're holding a stick, just having them balance that stick like this and doing that, and that helps improve their proprioception and balance. Another one is just standing up against a wall, leaning over and doing some wall push-ups, okay? Another one is standing with your, the chair is a really good one because you also use that and doing toe raises for your calves. So there's and these exercises actually literally only take about 5 to 6 minutes to do for all 10 of them. And then we've suggested that she do them 2 or 3 times a day, which will help improve all things. So that's really kind of a very short topic I wanted to address today. Just because I'm talking for a short time doesn't mean it's not really very important. Thank you. Any questions? Yeah. So the YouTube channel is called Healthy Lifestyle Solutions. And a lot of my talks, even some of these and some of my more formal talks are on there, and we can put that on there as well. Yeah. You also have to deal with the person where they are. And so if these things like the handle on the door and a walker, we started with walking sticks for her, but that didn't work out. Maybe a 4-prong cane or a walker, anything that you can do to kind of help them reduce their fall risk is really important. Did you have a question? Yes, sir. Yeah, so that's why I was saying, he said maybe I want to address traumatic brain injury. And, we always think about, like I said, the hip fracture, the femur fracture, but also head injuries are a significant issue. A lot of falls I see happen in the bathroom. And then if somebody falls and hits their head on the porcelain toilet or the sink or the bathtub, I mean, that's a pretty significant impact. Some famous person died. There was some controversy about how they died, but they found him dead in his bed when he was traveling on the road doing an act. And they determined he had hit his head. Eventually, they went backwards and figured out that he hit his head in the bathroom. So Bob Saget fell and hit his head. And so traumatic brain injuries are a significant issue as well. Shoulder injuries.
Yeah, rotator cuff tears.
Yeah. No, he's exactly right. So he said within his group and for men, I will just say for anybody, when people fall, they tend to put their hands out. A lot of people don't know how to fall. It's not unusual or atypical for people to stick those hands out and lock their arms. And when they impact the ground, there's a couple of injuries, 2 main injuries. One is what we call a Colles fracture. That's both the radius and the ulnar get fractured at the wrist. And then the other one is a shoulder injury. Maya had a shoulder injury from falling. And she tripped over the carpet, which is an obstacle. And months of physical therapy. So, okay guys, let's get up and walk.